Hello all. So today we will discuss regarding periodontal abscess. Okay. So the coming to the introduction. Periodontium is a general term that describes the tissues that surround and support the tooth structure. So as you know that periodontium consists of four things, that is hard and soft tissue. Hard tissue include your cementum and alveolar bone, and that soft tissue includes your gingiva and periodontal ligament. So, periodontium is a general term that describes the tissue that surround and support a tooth structure. The periodontal tissues include the gums, the cementum, the periodontal ligament, as I said. Okay? Among several acute conditions that can occur in periodontal tissues, the abscess deserves special attention. Periodontal abscess is the third most frequent dental emergency, representing 7 to 14% of the all dental emergencies. As we know that in case of treatment plan, our first emergency case will be the treatment of any kind of abscess. When the patient first visit near to you, when you then we should always go for the emergency treatment for draining the abscess. Okay. Abscesses of the periodontium are localized acute bacterial infection which are confined to the tissues of the periodontium. Now coming to the classification of periodontal abscess, classification is based on etiological criteria as periodontitis related abscesses, non-periodontitis related abscesses. Classification based on the course of the diseases like acute and chronic periodontal abscesses. Classification based on the number, that is single, whether it is single abscess or multiple abscess. Coming to the microbiology of the periodontal abscess, that what type of bacteria it contains. The Streptococcus viridans is the most common isolate in the exudate of periodontal abscesses when aerobic techniques are used. It has been reported that the microorganisms that colonize the periodontal abscesses are primarily gram-negative anaerobic rods. High frequencies of Porphyromonas gingivalis, Prevotella intermedia, Fusobacterium nucleatum, Campylobacter rectus, and Caphnocytophaga species have been reported. Spirochetes have been found as a predominant cell type in periodontal abscesses when accessed by dark field microscopy. Okay. Coming to the pathogenesis of periodontal disease or periodontal abscess, there are extension of infection from a periodontal pocket deeply into the supporting periodontal tissues and localization of the suppurative inflammatory process along the lateral aspect of the root. So what is periodontal pocket? Periodontal pocket is the pathologically deepened gingival circle. So as it says that extension of infection from a periodontal pocket deeply into the supporting periodontal tissue. So the infection which is causing in the periodontal pocket is going deeply into the periodontal tissue, and it causes the localization of suppurative inflammatory process along the lateral aspect of the root. Lateral extension of the inflammation from the inner surface of the periodontal pocket into the connective tissue of the pocket wall. Then localization of the abscess results when drainage into the pocket space is impaired. Anyhow, when there is impairment of the pocket space, there will be abscess formation. Formation in the pocket with the tortuous correct course around the root. Okay, so when the course is around tortuous, okay, around the root, the periodontal abscess may form in a cul-de-sac and the deep end of which is shut off from the surface. So it may appear as a cul-de-sac appearance where one side is open, one side is shut off. Incomplete removal of calculus during the treatment of the periodontal pocket, it results in a pathological condition. The gingival wall shrinks, occluding the pocket orifice, and periodontal abscess occurs in a sealed off portion of the pocket. After the trauma to the tooth or with perforation of the lateral wall of the root in endodontic therapy, it may result into periodontal abscess. So how does it look like microscopically? So an abscess is a localized accumulation of viable and non-viable polymorphonuclears within the periodontal pocket wall. So the polymorphonuclears liberate enzymes that digest the cells and other tissue structures, forming the liquid product known as the pus, which constitutes the center of the abscess. An acute inflammatory reaction surrounds the purulent area and the overlying epithelium exhibit intracellular and extracellular edema invasion of the leukocytes. Localized acute abscess becomes a chronic abscess when its purulent content drains through a fistula into the outer gingival surface or into the periodontal pocket, and the infection causing the abscess is not resolved. Diagnosis. The diagnosis of a periodontal abscess is usually based on the chief complaint and the history of the presenting illness. Usually, the severity of the pain and distress will differentiate an acute from a chronic abscess. ठीक है. Other diagnosis may be radiograph. It may reveal, but sometimes because abscess, if it is present on the buccal or the lingual or palatal aspect, it cannot be seen in a radiograph. But it is present if it is present in the interproximal area. You will see a radiolucency over there. It depends on the size of abscess also. Microbial tests can be done to check whether what type of bacteria is present in the periodontal abscess as a pus. And then lab finding laboratory investigations for ESR, like we can go for ESR, we can check the abscess, we can check the localized pus over that smear. Okay. Coming to the treatment of the periodontal abscess, the treatment of the periodontal abscess does not differ substantially from that of other odontogenic infection. The principles for the management of simple dental infections are as follows. Drainage. It may be pocket drainage, it may be incision drainage. Coming to the second is maintain drainage and eliminate the cause. Okay. After that drainage, you can ask the patient to continue check whether the abscess is completely gone or it is spilling out or what. Systemic measures in conjunction with the local measures, it may be immediate management, initial management, and definitive therapy. So this is the case as you can see here. This is the case where you can find the periodontal abscess in relation to 2:1, and radiographically you can see a radiolucency over here. Then after that, what we did just give a digital pressure over that, so you can see that pulse is coming out from that 2:1 area. And after that we can go for incision and drainage of the process. So we can use a 11 number blade and we can give a stab incision inside there. Okay. Then we can use a curette to break the loculi inside the abscess, and here it is, you can see the abscess has been drained properly. Immediate management. What we can do in immediate treatment? Immediate management is usually advocated in life-threatening infections which lead to space infection of the orofacial regions or diffuse. So when we talk about immediate management, we do always in case of fatal conditions where the patient life is a question. So hospitalization with supportive therapy together with intravenous antibiotic therapy is very recommended. Coming to the initial therapy may drainage through the pocket or retraction or incision, scaling and root planning you can do, periodontal surgery we can plan, systemic antibiotic we should give, and tooth removal can be done. Definitive treatment. The treatment following reassessment after the initial therapy is to restore the function and aesthetic and to enable the patient to maintain the health of the periodontium. Definitive periodontal treatment is done according to the treatment needs of the patient. So this is all about the periodontal abscess. Thank you for listening to this. Thank you.